Hello, everyone. I am Michelle Gurvitz. I am an adult congenital heart disease cardiologist at the Boston Adult Congenital Heart Program here in Massachusetts, and we are based out of Boston Children's Hospital and Brigham and Women's Hospital. I'm here today to talk to you about the new adult congenital heart disease guidelines for care that were produced at the end of 2025 by the American College of Cardiology and the American Heart Association. One big topic I wanted to talk about today was access to care for patients with adult congenital heart disease. Most patients do require care by an adult congenital heart disease specialist, and our new guidelines recognize that this can be quite challenging for many patients who may not have access to a large adult congenital heart disease specialty center, either for insurance reasons or transportation or geography. And our new guidelines try to address this issue. One thing that we added to the guidelines is the idea that patients can be seen in collaboration with an adult congenital heart disease physician and specialist, but perhaps also cared for by a local cardiologist to whom they might have easier access. And as long as these cardiologists can work in tandem and work as a team for the patient, that way the patient can be seen and have regular access to their cardiology care as well as guidance on congenital care and have a place to go should they need any specialized congenital heart procedures or interventions moving forward. In the 2018 guidelines, there was a statement regarding collaboration with cardiologists. However, we tried to expand on this statement for patients at different levels of congenital heart disease complexity and try to make that guidance a little bit more clear for patients so they could bring that to their doctors and help guide their own care. One other area I wanted to touch on was the anatomic and physiologic classifications that are in the 2025 guidelines. This is a concept that was introduced in the 2018 guidelines to help us understand better patients' level of disease complexity. For example, patients with tetralogy of Fallot anatomically may not have the same clinical course moving forward, where some may require only one surgery when they're younger and not require anything else before they become an adult. Other patients with tetralogy of Fallot may have had 3 or 4 surgeries or catheter type interventions by the time they become an adult or in their early adulthood. What the anatomic and physiologic classification system does is help both healthcare providers and patients understand disease severity a little bit better. And this helps guide what types of testing that may be recommended, what types of risk patients may be at for complications moving forward or repeat hospitalizations, and is helping us to understand the trajectory or guide guide of their disease uh, as they move into and later into adulthood. What the 2025 guidelines did was build on these physiologic recommendations and try to enhance them and make them more specific when it came to different levels of care. For example, uh, the 2025 guidelines in level D, which is the highest complexity, now include specifications if somebody has been ill with endocarditis in the last year or ill with a heart failure hospitalization in the last month. This now moves them into a level D level of risk, which means they should be watched a little bit more closely or perhaps have more contact with their physician or more testing. Between 2018 and 2025, there were some studies put out that showed the anatomic and physiologic classification was helpful in caring for patients. But there were still areas that needed to be improved. And the hope with the 2025 guidelines is that there are some improvements in this specification and improvements in helping us care for patients. For patients and for cardiologists who are looking at the guidelines, they can also help try to maybe put themselves in a category that may also help them understand how they're getting their care and where they're getting their care or why they're getting certain types of tests. As people look at the adult congenital heart disease guidelines, there are different sections for most of the different congenital heart conditions that people can be born with. However, we also put in and built on the 2018 guidelines some general sections that apply to many patients. And these are things that are felt to be important to patients' overall health and lifelong care. So these include sections related to mental health, sections related to physical activity and exercise, and sections related to reproductive health. Some examples of this would be that the mental health section, for example, previously included discussions regarding depression and anxiety. And now we've expanded that section to also include talking to your healthcare provider about uh, screening for mental health conditions, including things like anxiety and depression and PTSD. There are also recommendations that discuss the potential for neuropsychiatric or neurodevelopmental issues that people may have had when they were children that may remain issues into adulthood. And finally, also a recommendation to think about screening for cognitive or memory issues in our adult patients. Similarly, with physical activity, we try to specify a little bit more the importance of talking to your doctor about physical activity recommendations and what types of exercise are appropriate for you and for your heart condition. An additional very large section in this more general part of the guidelines has to do with reproductive health and contraception. This is a very big topic among our patients regarding the potential to have children in the future, um, the potential to pass on conditions from a parent to a child, and the potentials for timing pregnancy of when that might be appropriate. This section goes into quite a bit about what types of team should be developed to help people have a healthy pregnancy if that's appropriate. They also talk about other ways to have families that patients may consider, including things like assisted reproductive technologies uh, and um, and how that might how their cardiac condition may play into those types of that type of care. Working on these 2025 guidelines made me realize how much we've learned in the last 8 years since the publication of the last set of guidelines, and how much research has been done in the field of adult congenital heart disease, and how much we've strived to improve care for patients with adult congenital heart disease. However, it also was a humbling experience in the sense that we still have so much to learn. And I hope that these guidelines will help guide care for patients with adult congenital heart disease that uh, that will help improve their lives and improve their outcomes moving forward. But I also hope it will serve as a springboard for researchers and families and patients and healthcare providers to continue to improve care for our patients with adult congenital heart disease and continue to move the field forward to make the next set of guidelines even better than the ones we have now. I'd also like to thank the Adult Congenital Heart Association for giving me the opportunity to speak to everyone today about the guidelines and for their incredible continued support for patients, for research, for healthcare providers in the adult congenital heart disease community.